The global health community is closely monitoring a developing crisis in the Atlantic as the cruise ship MV Hondius, a vessel owned by Oceanwide Expeditions, serves as the epicenter of a deadly hantavirus outbreak. As of May 11, 2026, the ship has arrived off the coast of Tenerife in the Canary Islands, after a month-long ordeal that has claimed 3 lives and left multiple others in critical condition. The vessel originally departed from Ushuaia, Argentina, on April 1 for what was scheduled to be a 33-day journey across the South Atlantic, including stops in Antarctica, South Georgia, and several remote island territories. However, the voyage transitioned from an expedition into a medical emergency as a cluster of severe respiratory illnesses emerged among the 147 individuals on board, representing 23 different nationalities. Public health officials have identified the pathogen as the Andes strain of hantavirus, a particularly concerning variant because it is the only known species of hantavirus capable of limited person-to-person transmission through close and prolonged contact. While hantaviruses are typically categorized as rodent-borne pathogens, the confined environment of the cruise ship has created a unique set of challenges for containment and surveillance. The World Health Organization was formally notified of the cluster on May 2, 2026, and since then, the situation has escalated into a multi-country response involving the international health regulations focal points. The gravity of the situation is underscored by the high mortality rate associated with hantavirus pulmonary syndrome, which often involves a rapid progression from flu-like symptoms to acute respiratory distress and cardiogenic shock. For the 88 passengers and 59 crew members who have been restricted to their cabins for much of the final leg of the journey, the arrival in Spanish waters marks the beginning of a complex disembarkation and repatriation process governed by strict biosecurity protocols. This incident serves as a stark reminder of the complexities inherent in monitoring zoonotic diseases in mobile populations and the critical importance of rapid international cooperation when a localized outbreak threatens to cross international borders via maritime and air travel routes. Detailed epidemiological investigations indicate that the outbreak likely originated prior to the ship's departure or during early land-based excursions in South America. Investigators believe the index case may have been a passenger who spent significant time traveling through Argentina and Chile, regions where the Andes virus is endemic in rodent populations, before boarding in Ushuaia. The timeline of the outbreak began as early as April 6, when an adult male passenger developed a fever, headache, and gastrointestinal distress. His condition deteriorated rapidly into respiratory failure, and he died on board on April 11. Because no microbiological testing was available on the ship at that time, the cause of death remained uncertain until subsequent cases emerged. A second fatality occurred on April 26, involving an adult female who was a close contact of the first victim. She had disembarked at St. Helena on April 24 but fell ill during a flight to Johannesburg, South Africa, where she died upon arrival at an emergency department. A third passenger, a German national, died on May 2nd. Beyond these fatalities, medical evacuations have been carried out for several others, including a British man who was flown from Ascension Island to South Africa on April 27th and remains in intensive care. More recently, a British crew member and a Dutch colleague were evacuated from the vessel as it neared the Canary Islands, requiring urgent care for severe respiratory symptoms. The World Health Organization, led by Director General Dr. Tedros Adhanom Ghebreyesus, has deployed experts directly to the ship to conduct medical assessments and has facilitated the shipment of 2,500 diagnostic kits from Argentina to laboratories in 5 countries to bolster testing capacity. While the cruise operator, Oceanwide Expeditions, reports that there are no signs of a rodent infestation on the ship itself, the WHO Director for Epidemic and Pandemic Preparedness, Maria van Kerkhove, has confirmed that human-to-human transmission is the suspected driver of the cabin-based clusters. This development has triggered intense monitoring of anyone who disembarked from the ship during its stops in late April, including a resident of the remote territory of Tristan da Cunha, who is currently under observation by British Army medics. As the disembarkation process begins in Tenerife, the public health response has transitioned into a global surveillance phase aimed at preventing further secondary transmission. Passengers leaving the MV Hondius are being ferried to shore in small groups and are prohibited from making any contact with the local population in Spain. From there, they are being transferred to specialized evacuation flights organized by their respective home governments. The World Health Organization has issued a formal recommendation for a 40-day to 45-day quarantine period for all exposed individuals, corresponding to the maximum known incubation period for the Andes virus. This protocol is being implemented with varying degrees of stringency across different nations. In Singapore, 2 residents who were on the ship are currently isolated at the National Center for Infectious Diseases, where they face a mandatory 30-day quarantine followed by phone surveillance. In the United States, the Centers for Disease Control and Prevention is taking a risk-based approach, conducting interviews with the 17 American passengers upon their arrival at a biocontainment unit in Nebraska to determine if they require facility-based or home-based isolation. Meanwhile, France and Norway have deployed specialized medical aircraft and are requiring 72 hours of hospital monitoring before home quarantine. The MV Hondius itself is scheduled to sail to Rotterdam in the Netherlands, where it will undergo a comprehensive professional disinfection process under the supervision of Dutch health authorities. Medical experts emphasize that while the Andes strain is dangerous, the risk to the general public remains low because the virus does not spread easily through casual contact, typically requiring the inhalation of aerosolized rodent excreta or very close, prolonged intimacy with an infected person. Officials continue to stress that those who have recently traveled in South American rural areas or have been in contact with individuals from the ship should monitor for symptoms such as high fever, muscle aches, and sudden shortness of breath. The investigation into the exact source of the primary infection continues, as labs in South Africa, the UK, and Singapore work to sequence the viral genome to better understand this specific cluster. For further updates on international health surveillance and travel advisories, stay tuned to official government health portals. The epidemiological response to the MV Hondius outbreak reached a critical turning point on May 2, 2026, when the United Kingdom's International Health Regulations focal point formally notified the World Health Organization of the cluster. By this stage, the National Institute for Communicable Diseases in South Africa had provided the first definitive laboratory confirmation, identifying the pathogen as the Andes strain of hantavirus. This discovery was pivotal. Unlike most hantaviruses, the Andes variant is documented for its rare capacity for person-to-person transmission, a factor that immediately elevated the international risk assessment. Data released by the WHO and the European Centre for Disease Prevention and Control, or ECDC, details a sequence of events beginning with the index case on April 6. An adult male passenger developed symptoms of fever and gastrointestinal distress, succumbing to respiratory failure on April 11 while the ship was still at sea. His remains were later transported to St. Helena on April 24. In a tragic development that highlighted the risks of close contact transmission, his wife also fell ill, disembarking at St. Helena before traveling to Johannesburg, South Africa, where she died on April 26. These early cases triggered a massive trace effort covering 29 individuals who had left the vessel during its stop in St. Helena, including 7 British nationals. Testing protocols were rapidly scaled up, with 2,500 diagnostic kits dispatched from Argentina to laboratories in 5 countries to manage the testing of suspected cases across different jurisdictions. The clinical management of the outbreak involved several high-stakes medical evacuations from remote Atlantic locations. On April 27th, a male passenger in respiratory distress was airlifted from Ascension Island to a specialized intensive care unit in South Africa. As the ship continued its journey toward the Canary Islands, the medical situation worsened, leading to the emergency evacuation of a British crew member and a Dutch crew member on May 6. These individuals were transported from the vessel near Cape Verde to receive urgent care for acute respiratory symptoms. To stabilize the remaining passengers and crew, the Dutch government dispatched 2 medical specialists to the ship while it was still in transit. In a press briefing from Geneva, Maria van Kerkhove, the WHO's Director for Epidemic and Pandemic Preparedness, confirmed that the organization suspects human-to-human transmission occurred among cabin mates and close contacts. Van Kerkhove addressed the passengers directly, acknowledging their fear while reassuring them of the ongoing international coordination. This professional assessment countered initial concerns regarding a potential rodent infestation on the vessel. Extensive hygiene and environmental inspections conducted by experts found no evidence of rodents on board, leading investigators to focus on the theory that the virus was introduced by a passenger who had been exposed in endemic regions of Argentina or Chile prior to embarkation. Political and health authorities have been working in tight coordination to manage the logistics of the ship's arrival. Tenenor. Spanish Health Minister Mónica García announced that the MV Hondius passed all required medical checks before being allowed to anchor off the port of Granadilla on May 10. The repatriation process is being conducted under strict biocontainment protocols to ensure zero contact with the local population. Spanish citizens were the first to disembark, followed by nationals from the Netherlands, Germany, Belgium, and Greece. British Prime Minister Keir Starmer has publicly stated that the UK government is implementing comprehensive plans for the onward travel and monitoring of its citizens. The ECDC has officially classified every individual on the ship as a high-risk contact, mandating a rigorous 42-day to 45-day monitoring period from their last point of exposure. This directive is being implemented globally. For instance, the Dutch Foreign Minister Tom Berendsen confirmed that a chartered flight has already transported dozens of passengers to Eindhoven, where they will undergo home-based or facility-based quarantine, as determined by the National Institute for Public Health and the Environment. Throughout these developments, the central challenge remains the virus's long incubation period, which can last up to 8 weeks. Necessitating a prolonged and resource-intensive surveillance phase for all survivors and their recent contacts. The transition from maritime isolation to terrestrial quarantine marks a critical phase in the international effort to contain the Andes hantavirus outbreak originating from the MV Hondius. As passengers are processed through the port of Granadilla in Tenerife, the World Health Organization has underscored that the primary challenge for public health agencies is the virus's exceptionally long and variable incubation period. While many viral infections manifest within days, hantaviruses can remain dormant in the human body for up to 8 weeks before the onset of symptoms. Consequently, the WHO and the European Centre for Disease Prevention and Control have mandated a minimum observation period of 42 to 45 days for all 147 individuals associated with the vessel. This rigorous timeline is being reflected in diverse national responses. In Singapore, 2 residents are currently being held at the National Center for Infectious Diseases, where they face a mandatory 30-day institutional isolation followed by 15 days of active phone surveillance. In the United States, the Centers for Disease Control and Prevention has designated a biocontainment unit in Nebraska as the primary screening point for the 17 returning American passengers. Medical teams there are utilizing a risk stratification approach, conducting deep dive interviews and baseline blood work to determine whether passengers require high-level facility isolation or if they can be monitored through strict home-based protocols with daily temperature checks and symptom reporting. For the broader public and the travel industry, the MV Hondius incident provides a definitive template for managing zoonotic risks in confined environments. Public health guidance remains focused on early detection of hantavirus pulmonary syndrome, or HPS. Health officials advise that anyone who has been in recent contact with individuals from the ship or who has traveled in rural South American regions should be vigilant for early symptoms, which include fatigue, high fever, and deep muscle aches, particularly in the thighs, hips, and back. These are often accompanied by headaches, dizziness, and gastrointestinal distress. The late symptoms, which typically appear 4 to 10 days after the initial phase, are significantly more severe and include a persistent cough and sudden shortness of breath as the lungs begin to fill with fluid. The practical takeaway for the maritime sector involves a renewed focus on environmental surveillance, Although no rodents were found on the MV Hondius, the vessel is scheduled to undergo a deep clean and comprehensive disinfection in Rotterdam. This process involves the use of specialized virucidal agents designed to neutralize aerosolized pathogens. Experts note that while the Andes strain is the only hantavirus known to spread between humans, this transmission typically requires the kind of prolonged, close-quarters contact found in shared cabins or households, meaning the risk to the general public in transit hubs remains statistically low. Significant scientific uncertainties still surround this specific outbreak, and international labs in South Africa, the United Kingdom, and Singapore are currently engaged in genomic sequencing of the viral samples. These scientists are looking for any mutations that might explain the efficiency of the transmission observed during the April voyage. Ethically and logistically, the situation has sparked a debate among global health leaders regarding the protocols for floating quarantines. Director General Dr. Tedros Adhanom Ghebreyesus has emphasized that while the restriction of movement was necessary for global biosecurity, the mental and physical health of the trapped passengers must remain a priority during their transition to land-based care. The investigation also continues into the exact index case, identifying whether the first patient was exposed via a specific rodent reservoir in Argentina or Chile is vital for preventing future clusters. As the final passengers board their respective evacuation flights and the MV Hondius prepares